Patients with metastatic kidney cancer, we use the IMDC criteria, which help us to both provide patients with an outline on prognosis and, importantly, help select therapy in advanced kidney cancer. The abstract we're presenting, usually there's 3 risk groups, the favourable, intermediate and poor risk groups. But we see quite diverse outcomes for patients with favourable risk disease, and we were interested to see whether we could refine the prognostic criteria to identify patients who have a very favourable prognosis. And so what we did is we utilised the IMDC data set. This is a large international collaborative framework where we've collected a large amount of data on patients with kidney cancer. And we took patients with favourable risk disease and looked at baseline clinical and laboratory features. And what we found is that we were able to identify a very favourable risk group of patients. And we defined this using the sites of metastatic disease, so patients without brain, bone or liver metastases, the time from diagnosis to metastatic disease of being greater than 3 years, and also the Karnofsky performance status of being more than 80%. So if a patient had all 3 of those, they were classed as very favourable risk. And what we found is that these patients had a more prolonged survival. And what we're now looking to do is to see whether we can correlate this with underlying disease biology and down the track to see if this might have potential therapeutic relevance in the future. So in summary, we found that we could use baseline clinical and laboratory parameters to identify a very favourable prognostic group of patients.